The recent introduction and marketing of direct-to-consumer genetic testing creates a complicated relationship between patients, doctors, and corporations. The 2004 statement by the American College of Medical Genetics frames this controversy. They write, "Genetic tests of individuals or families for the presence of or susceptibility to disease are medical tests. At the present time, genetic testing should be provided to the public only through the services of an appropriately qualified healthcare professional. The healthcare professional should be responsible for both ordering and interpreting the genetic tests, as well as for pre-test and post-test counseling of individuals and families regarding the medical significance of test results and the need, if any, for follow-up. Due to the complexities of genetic testing and counseling, the self-ordering of genetic tests by patients over the telephone or the internet, and the use of genetic home testing kits is potentially harmful. Potential harms include the inappropriate test utilization, misinterpretation of test results, lack of necessary follow-up, and other adverse consequences." The following scenes explore the transmission of genetic testing information by corporations who are not certified healthcare professionals. Given the lack of clinical validity and emotional anxiety that can result from genetic tests, federal regulation of both direct-to-consumer advertising as well as testing will be explored.
I've always known that breast cancer was a serious health risk for thousands of women each year, but what I didn't know was whether or not I was at increased risk.
Last year, my sister was one of 180,000 women diagnosed with breast cancer. Together, we wanted to learn as much as possible about the disease. I found out that with just a simple blood test, I could learn whether I have a gene mutation that could tell me about a condition called hereditary breast and ovarian cancer syndrome, or HBOC.
The process was easy. I went to a licensed laboratory near my home to give a small blood sample and mail it to Genesis. Within a couple of weeks, a genetic counselor from Genesis called to discuss my results and answer all my questions. Now, I'm so glad I know. If breast cancer runs in your family, call or go online today to find out how Genesis can help you plan for your good health.
For today and your future.
Hello?
Hi, this is Guy Swanson. May I speak to Kathy Komen?
This is she.
Hi, Kathy. I'm a genetic counselor calling from Genesis, the company that you sent your blood work to. How are you doing today?
I'm fine, thank you.
Today we're scheduled to have a counseling session about the genetic test that you took. Is right now still a good time for you?
Yeah, it's fine.
Okay, before we begin, I'm going to need to verify your family history with you real quick. My information says that you had a cousin on your paternal side that may have been diagnosed with breast cancer between 6 and 10 years ago?
Yeah, I did.
Okay, and my information also says that you may have had an aunt on your mother's side who may have died of breast cancer?
I think so. This part's less clear. My mom and her family had a falling out, and she died a couple of years ago.
That's understandable. Okay, well, real quick, do you have any questions about the test process or anything before we talk about the results?
Yeah, I want to know what the results are.
Okay. The results of your test have come back positive for a gene mutation to the BRCA1 gene. This means that you have a greater likelihood, given your family history, of developing breast or ovarian cancer. The numbers are 35 to 85% chance of developing breast cancer later in life and 16 to 60% chance for ovarian cancer.
Whoa. 30 to 85%. So from not much of a chance to I'm going to have breast cancer?
That's the best we can do given your relatively unsure family history, and that we can't test any member of your family who may have died from breast cancer or been diagnosed with breast cancer for a similar mutation. Without that information, it's hard to give a more specific number.
So, your commercial
said that I would have a certain level of peace of mind. You've told me that I either do or do not or will not have breast cancer. What is the answer?
Well, Miss Common, all we can do here at Genesis is we attempt to give you the best information available given current medical science. We also hope to give you information in terms of what options may be available to you given this information.
So what do I do?
Well, let me begin by prefacing this by saying that you should talk to your doctor before making any sort of medical decision about your future.
I had this test done so I wouldn't have to talk to my doctor. If I wanted to talk to my doctor, I would have had it done there.
Well, the purpose of Genesis and doing it directly to yourself is that you will have more control over this information and you can make a more educated guess as to how you want to deal with your doctor about this information.
Well, Mr. Counselor, why don't you give me an educated guess as to what I'm supposed to do?
Well, I can give you two main tracks of information in terms of what you could possibly do. The first route is a non-invasive route. This involves two basic options. One is to get your yearly mammogram and clinical examination, and this is going to be critical for you because with your increased information and your increased genetic predisposition to possibly getting breast cancer and developing breast cancer later in life, this will help for possible early detection. The other option that's non-invasive is the possibility of taking a preventive medicine called tamoxifen. These options should again be explored more closely with your doctor. The other track is that some individuals choose to take is to have preventive surgery, including a mastectomy or an oophorectomy. Either of these choices are optional, and again, I stress that you should speak to your doctor to best explore your options.
So wait, you're telling me that I could either do something that I would have done anyway, I could take some drug that I'm going to have to pay for, or I could just have my breasts cut off and my ovaries removed. Are these my options, Mr. Swanson?
Well, these are the options that are currently available to you. Thankfully, because of the movements forward in genetic testing and our ability to deal with and understand genes better, more options may be open to you in the future, which is why this information is so imperative. However, while this is a small list of options, your doctor will be able to best advise you on what you should do.
So what do I do? What do I do?
We recommend here at Genesis is to talk to your doctor about this information, be it your family practitioner or an OBGYN, and have them give you the best information given your medical history, your conditions that are more specific to just you.
But you're a counselor. I mean, aren't you a doctor?
No.
Who the hell am I talking to?
I'm a genetic counselor, which simply means that my job is to give you all of the information that we have in terms of what you can do with your newfound information. We can't give specific medical analysis and medical decisions to you because we don't know you well enough. We're not close to you like your doctor, and we don't have a complete history report of you and your medical history. We believe that you should go to your doctor with this information at your earliest convenience.
Listen, Mr. Swanson, I know that you've got stuff that you need to say and do, but level with me. Am I going to get cancer?
All I can tell you is that you
No, don't all I can tell you me. I've got kids at home. Am I going to die? What do I do?
Ms. Coleman, I understand that there's probably an increased level of anxiety and stress given the uncertain ability of the information given to you today, but the best advice we can give you is to go to your doctor. This will give you a more complete idea of what the results may mean to you given your medical history.
All right, fine.
Is there anything else I can help you with today?
No.
Thanks. Have an awesome evening.